guidance and information on how that will impact Kern County and our ongoing attempts to be prepared and continue to prepare. Another update is testing. So the testing criteria for persons that are tested has changed yet again. And it has been expanded to test a wider group of symptomatic patients. So clinicians now can use their judgment to determine if a patient has signs and symptoms compatible with COVID-19 and whether the patient should be tested. This will likely expand the number of tests being conducted as they are allowing, more of the provider input. Those really conclude my updates. So now you are free to ask a few questions.
So we've heard, if you have non-essential travel, don't take non-essential travel to these places. But how does the CDC define non-essential travel?
First, that's a great question because we're getting that a lot. First, I encourage everyone, when it comes to the travel guidance and restrictions, it is changing by the minute. The CDC is the one administering those guidelines. It is on their website. You can go to kernpublichealth.com, which will link you directly to that travel page to make it really easy. Non-essential travel, in essence, this is the highest warning we can give, the Centers for Disease Control can give. So if you don't have to go for a very important reason to you, what that means for you is going to be individual. You should not go.
How many calls are you receiving from the public on a daily basis? Are you seeing that there's worry in our community despite there still not being any confirmed cases?
Yes. We are ramping up our call center ability to properly distribute the phone calls that we're receiving. Our community is very interested. We're hearing from not just the community at large, but our partners, folks that are either caring for in the healthcare setting, from our schools. So our phones are ringing. We are very, very busy, and it's important to us that we have developed an infrastructure to return all of these calls. Referring people to our website is really important because there's a lot of information there, and we're going to continue to keep that updated, but our call activity is very high.
When somebody calls you guys because they worry that they might have symptoms of the virus, what's the protocol? Just kind of questionnaire that you answer?
Yes, we are following everything that's coming down to us from the Centers for Disease Control. They have given guidance on all of these things. There is also our 911 infrastructure has been expanded to include questions of travel, symptoms. There is a series of questions that have been given to us for all these different settings that we are following. So once we get through that, then we are able to direct the person to do the next appropriate step, depending on things like travel history and symptoms.
Michelle, anyone on that cruise ship coming from Mexico that's stopped in Hawaii, does Kern Public Health know if anyone being tested for coronavirus symptoms are from Kern County?
I am waiting for that information. We don't know at this time. We are aware of the situation. We know what's going on. We discussed it this morning, but I don't have any information on that yet.
How serious should people even take the coronavirus? I feel like throughout every year, there's always another disease, and people freak out about it. Should people even be freaking out about the coronavirus?
I'm really glad you asked that question because, our staff, we live and work here too, and we're going home to our families and our friends, and we are getting the same concern and fear and questions. And there is a lot of fear. There's a lot of, we're seeing a lot of images around the globe that are startling and would cause anyone to be concerned and fearful. We do need to remember what we know now, and what we know now is 80% of the known cases are mild symptoms, not even requiring hospitalization. There is a small percentage of those that are becoming much more ill, and then unfortunately the deaths. We are realizing those are persons over the age of 65 and those with compromised immune systems. those unfortunately are the same groups that are going to be more vulnerable to all of the infectious diseases, flu, for example. So, you know, comparing it to something like seasonal flu, which we take very seriously here at the health department, because we've had 11 deaths to date this season because of flu in this county. So my answer would be, we need to be alert, we need to be aware. We do not want another infectious disease in the United States. So we're fighting hard against that. That's what public health does. That's what the Centers for Disease Control does. We don't want anything, but this is proving to be very similar, you know, the way that it spreads. They're saying, you know, try to keep 6 feet between you and someone that is sick. The basics of washing your hands. So be alert, but there is not a need to be fearful at this time, because your public health department, we are prepared. We are getting phenomenal support and resources from the state and the federal government. So I hope that answers your question.
Yes.
There's some pretty big events happening in the next couple of days, like Star Wars night at the Congress game, Bakersfield, New York, Orchestra. Should there be any hesitation for mass gatherings, events like that, for people to go out to events like that?
No, and we're getting a lot of questions in our call center about, you know, going out at public gatherings. There has been no guidance given that we should restrict any of those activities. Again, you're seeing some of those activities in areas where it is circulating, and those decisions are they're being made based on what is happening. In Kern County, we don't have a single case confirmed at this time. So we are unaware of any spread happening here. So we will modify our recommendations based on CDC protocols if that were to change. But as of now, you need to go about your daily lives as you normally would, other than travel, and you would go to the CDC's website to modify any travel and make sure you're aware of all of those advisories.
Is public transportation a concern?
Not at this time. You know, we're really promoting the importance of sanitizing and cleaning. There is no special recommendations at this time, but during flu season and for high-touch areas, for things like transit, we recommend cleaning to happen all the time. This is a great time to remember that, I think. And when you yourself are in these areas that are high-touch, don't touch surfaces, then touch your face. Hand sanitizer, all of those things are important.
In some areas where it is circulating, you know, schools have been shut down and people are talking about stocking up on canned goods or stocking up on water. Is that something that public health is recommending for Kern County?
The guidance that's been coming down, and you're hearing it in some of the areas that it is, you know, Washington is using some of that language right now. What we're saying is, if it were to become more prevalent in our community, start thinking about what that would mean for you and your family. If you were to need to care for someone that was sick with any respiratory disease, what would that mean for you and your family? Being prepared for any kind of emergency is always a good thing. So being stocked up on these kinds of things, we should be thinking about all the time. You know, whether it's an earthquake, you know, and again, those are very different scenarios, but being prepared and asking yourself, in this case, what would it mean if I had to care for, or if I myself were sick, what would that look like for us and my family? Those are the kinds of things we want to start. Other than that, it's again, business as usual.
Michelle, you mentioned the testing criteria being expanded. Do you anticipate more people being tested in the coming days, weeks, especially with LA County just to our south?
Yes.
Declaring a state of emergency yesterday.
Yes, we expect more testing to happen, and this is a good thing. This is giving us the tools to diagnose, treat, isolate as necessary to mitigate the spread. So the availability of testing, the way that they've expanded the testing measures, that is a positive for our community, and we can expect to be testing more.
How do you determine exactly who gets quarantined and stuff like that? People are around so many other people when they're traveling, just going to the grocery store. How do you determine who needs to go in quarantine?
We've got clear guidance on that, and it's going to be a case-by-case basis. So again, we go back to what are the symptoms, what are the travel history. It's a very individual thing, but those proper isolation requirements are going to happen based on the risk the person poses to the community and for their own, protection. So it's really going to vary.
And how easy is this disease easily transferred?
What they're saying is the Centers for Disease Control, what we believe to be the case is like cold and flu season, within a 6-foot range, coughing, sneezing, these droplets. They also can land on a surface. They're discussing that could potentially live on a surface up to 24 hours. So again, if you're touching that surface, then touching your face. Those are the types of ways that you would be exposed to this. But we want to reiterate with the questions we're getting about wearing a mask. There is absolutely no recommendation to wear a mask if you are well. If you are sick with COVID-19, you would wear a mask. If you are a healthcare provider in close contact with a person that's been diagnosed, you would wear a mask and other actual PPE equipment, personal protective equipment.
About how long does it take between the time when you send a test to the CDC and when you get the results back, or does it vary?
It does vary. What the good news is, this is changing quickly. There are now laboratories that have been identified throughout the state of California that are going to be testing, I think, starting today. In Kern County, we are not conducting the tests here. We are submitting our samples to the state in Northern California, and they are conducting the test. So we're hoping within a 3-day period, we are going to have the test results back. I believe as they are expanding and getting more resources, this may quicken, but for now, that's what we think we're looking at.
How did you find out about, the 15 people that had traveled somewhere and then these other 4 cases? Were those like self-reported?
No. There is a infrastructure in place. If you are a traveler that has been in a high-risk area, you are being screened at one of the 11 airports throughout the nation. And if you are symptomatic, you are moving into a more isolation quarantine situation and not allowed to come home until that 14 days is expired. If you are fine and not showing symptoms, you are able to go home. Your name, however, is provided to local health jurisdictions so that we can follow up with you and do an initial assessment. And then if you require monitoring, we conduct that and work with you to keep you safe and the community safe.
So say after someone travels, they come back and wherever one of the checkpoints are, they have symptoms. They get quarantined there. After so much time, they stop showing symptoms. Does that mean they're fine? They don't have it anymore? Or?
Correct. Yes. So they would be, once in the guidelines that CDC, they're saying the 14-day quarantine period. Once that is expired, and if you do not have symptoms, then you are completely fine and well and able to go about your regular activities.
So it would be like a common flu, common cold type of thing?
Mm-hmm. Yes.
Are there any guidelines for like schools or universities?
There are, and they're actually on our website now because we're working very closely. We've met with both Bakersfield College and CSUB. We are working closely with the superintendent of schools that is then, getting it out to all of the other schools. This is probably, other than healthcare facilities, schools are one of the ones we are working with the closest. There are protocols in place, and they are, each school makes their own decisions, but we are providing a lot of guidance through the Centers for Disease Control.
You touched on the most susceptible are the elderly. What about children?
So the good news in all of this is we're not seeing a lot of children.